floaters are in the jelly part of the eye, which we call vitreous, so they're vitreous floaters. You're born with gel in the eye, and it's incredibly important before you're born, as it supports the whole structure of the eye. And after birth, it degenerates actually from birth, and keeps me employed actually. So it's quite useful that it's there, because as it degenerates, it causes all sorts of problems. And floaters are part of that. So as we age, the jelly is made up of water and protein, and the proteins clump together to form these bits and strings and little balls and things that people see floating around inside their eyes. And for the vast majority of people, floaters are not a bother. However, in some people, they can become a bother. And I would, you can go away and experiment with this. If you have a light above you in the ceiling and hold your hand out close to the floor, you will see a very sharp shadow of your hand. And these are like the distinct sharp floaters that float around. As you move your hand away from the floor towards the light, your shadow will become diffuse and grey. And these, I think, are the more significant floaters that people describe as clouds that come and go across the front of the vision. They're more significant after people have had cataract surgery, because the jelly tends to collapse inside the eye and bunch up behind the plastic lens sitting in the front of the eye. And just behind the lens can have a significant effect on the vision. So there are lots of different sorts of floaters, but the ones that I think are the most significant are the clouds that come backwards and forwards across the eye on eye movement. So I've said that floaters are very common, but there are floaters that you should worry about. So a sudden shower of floaters, especially if associated with flashing lights. We talk about the 3 Fs, so flashing, floaters, and then fading vision, because sometimes the jelly can tear the retina. So if you have sudden onset of flashes and floaters, or a sudden onset of a shower of floaters, you should seek urgent attention, because there could be a tear in your retina. Generally speaking, floaters are not a serious a sign of a serious underlying eye condition, except obviously if you get a shower of floaters and flashing lights, as I said earlier, then that could be a retinal detachment, so you need to seek urgent attention. There are some inflammatory diseases that can cause floaters, and there are things like diabetes, where you can get bleeding in the eye that can also cause floaters. You are likely to be under care for diabetes and inflammatory eye disease, and be under constant surveillance for that. So in the vast majority of people, floaters are just age-related degeneration and are of no concern of anything underlying, but can be a bother to patients' vision. So examining someone with floaters is really quite fascinating, because when I look as a doctor at the floaters, I'm shining light into a dark ball, and the light is bouncing back off the floaters, whereas the patient is seeing the light go through the floaters. So they're the other side of it. And the scatter of the light is many times worse, hundreds of thousands of times, if not 1,000,000 times worse, for the patient looking through the floaters than me looking at them. So in other words, I can't really diagnose floaters per se. I saw a lady the other day who had significant floaters that I could see very easily, but there are patients who come in and say, I've got floaters and I see very little. But that doesn't necessarily mean they don't have significant floaters. So I tend to trust the patient on this, and look for the symptoms. There are some more objective techniques we can use. So we have a machine called an OCT, which takes a lovely picture of the back of the eye, and the shadogram feature on that allows you often to see shadows of the floaters on the picture. And then fancier tools that look at the contrast sensitivity of the eye. So this is looking at not just black on white, but grey on grey, not just very thin, fine lines, but broad, blurred lines. That can show issues with the floaters and reduce contrast. The treatment that I would use is vitrectomy, so removal of the gel. There are laser treatments around. I'm not a fan of those. They've been around since 1993. And I look at the progress in all other areas of vitreoretinal surgery. I haven't seen the progress in the lasers. Again, there's the caveat that what I see is very different to what the patient sees. So what am I lasering? And perhaps lasering just breaks floaters up rather than actually eliminating them. So I don't do laser surgery for floaters. So I do a vitrectomy operation, which is the most common operation that I do. And this is done with modern techniques with tiny gauge surgery. So you don't need any stitches in your eye. It's done under a local anesthetic with or without the sedation, a bit of gin and tonic in the vein. And it takes around 15, 20 minutes to do. Surgery is comfortable throughout, and at the end of surgery, I may leave a small air bubble in the eye, which you will see for a few days afterwards. The risks of surgery include retinal detachment around 1 in 100, and if we get any damage to the retina, I would treat it and put a gas bubble in the eye, and that would be in there for around 2 weeks, and you can't see or fly with gas in the eye.